Train them. I'll pick up birds.
Again.
Huh? So you can test them, see if they have West Nile virus.
Oh, put your arm out the window, let them bite. There we go. All right, let's get this meeting started. Time being 9:01 a.m. on April 20th, 2022. I'd like to call this meeting to order of Kane County's Public Health Committee. Clerk, please call the roll for attendance.
Lewis,
Here.
Shepro, Strathman,
Strathman here.
Tepe, Wallace, Silva, Sanchez.
Sanchez here.
You have quorum.
Okay. If someone could ask unanimous consent to approve the minutes of March 16th, 2022.
So moved. Tepe moves.
Any objection? All right, minutes are approved. Finance and budget. Does anyone have any questions? We have Mr. Cannell Snowden on the line. If you have any financial questions for the health department, hearing none, we will move on to public comments on agenda items, and I'll be willing to entertain non-agenda items as well at this time. If there are any comments anyone would like to give. I see some, no, I think I recognize everyone's name online, so no one's here to speak. Okay, we have a discussion item. I think all the committees are going through this process right now to look at the county code, section 2-48. I'm sorry, I got here a little late. I do not have that pulled up for us to view together, but I know everyone's looked at it. Does anyone have any comments on potential changes, amendments, and I'd be willing to entertain ideas from staff as well if you guys have anything that you see. Let me try and pull this up here. Just give me one moment.
You have a hand raised.
Is there a hand raised?
Yes,
Oh,
this is
Kathy.
Interim Executive Director of Public Health, Kathy Foster, and I just wanted to say under number 6 of Public Health, it's the last sentence says, this committee shall also have jurisdiction over the Office of Emergency Management and the Office of the Animal Control Administrator, which shall include the purchase of supplies and equipment for said offices. So, you know, as we know, the Office of Emergency Management is now under the Sheriff's Department. So I believe that one needs to be moved.
Okay, let me pull this up real quick so everyone can see it together. Blair, I'm sharing this, the screen. Can you move it over to the monitor for us, please? So Kathy, you're referring to this section here, jurisdiction over the Office of Emergency Management So that is something that was changed a couple of years ago now, I think. And we
Yeah,
just haven't
many
caught up.
years ago, probably back in 2011 or
think it was-
2012.
No, I think it was, were they still reporting even a couple of years ago, I thought? Maybe not.
Oh,
But in any case, yeah, that has to get taken out. The reference to emergency management. There was some discussion about animal control and which committee they should report to. I know Madam Chair had raised a point about that, but I don't know. Mr. Kenyon, she had mentioned talking to you.
Agriculture.
I didn't understand do you know what the reason was to want to potentially
Ours is
move?
not the question. We just
Mr. Chairman,
thought it was
Mr.
more
Shepherd, how are you
related to
doing?
agriculture than sick humans. I don't know.
Okay, but yeah, she's not here really to speak. So, hi, Mr. Shepherd, how you doing?
Shepro, sorry to be late. When McConaughey was chair, the animal control reported directly to the chairman's office. And I think that was based upon the fact that the county veterinarian was a statutory provision. I think it landed with the health department over the objection of Mr. Keener to was then the executive director, but they couldn't figure out where to put it. So I think that might be part of the reason it just never seemed to fit.
We didn't have an agriculture committee then.
Yeah, that's correct. There was no agriculture committee.
So it was, made sense to go here rather than, let's say, development.
Yeah, and I think most of the northern counties in Illinois, their animal control reports to the public health committee as well, and whatever related committee. So
What was also involved is that this was the point at which the new facility was being constructed. And that was sort of a major project that magnified what was going on with animal control, perhaps more. I don't know that there's any, in my mind, there's no particular statute that says it ought to go here, ought to go there. I mean, it's,
well, if anyone on the committee is interested in exploring this idea, we can look into it and make any recommendations to, I think the Human Services Committee is compiling all of the recommendations from the other committees so that we can update this section of the code. So, yeah, I don't know if there's anyone that wants to explore animal control moving. I just don't know what problem it is that we're solving if we're trying to move animal control somewhere else. So that's what wasn't clear to me. Ms. Lewis.
Just my 2 cents. I think.
Mike, please.
Oh, I'm sorry. Louis, I think it belongs to this committee because the animal control is actually public health risk because you're talking about rabies and you're talking about, potential animal hazards and things. So it seems like it should go underneath this one. That's just my thought of why it's there.
Yeah, animals as opposed to livestock.
Mhm.
Yeah.
Absolutely.
Mr. Shepherd.
I wouldn't want to take anything away from Mr. Kenyon's committee, but it also occurs to me that although I think Elgin, I think, has its own animal control, and I'm not sure about Aurora, maybe someone could help me there, but the vast majority of what goes on is in urban areas and not necessarily in the unincorporated areas, which
That's
Yeah.
where you take your animals. You dump them on the farm. I mean, cats and dogs. Really, that's people do
for the
that.
past 20 years, all of our cats have come from people that have wandered up to our house and
Yeah.
when I wasn't home and the kids adopted them before I was allowed to vote on it. It's always sort of been an orphan in that sense. But yeah, I mean, it's basically the whole rabies control and all that. And one of the other things that I learned back then was that the only actual statutory mission of animal control for the county is rabies control. Everything else they do, including adoptions and so forth, is really something that the county has elected to do. And there was quite a discussion about that 20 years ago. So, if Madam Chair, I would suggest we let Mr. Kenyon and Madam Chair work that out.
We'll,
Well, again,
glad to help.
we'll pass on any suggestions. So if anyone has any recommendations, that's all this conversation is suggested changes to this. So feel free to send them to me and then I'll make sure that we funnel it to the Human Services Committee. I think this one is one we can all agree on. The Office of Emergency Management does not report to this committee for sure. So, Mr. Kenyon.
Maybe because we are in times drifting where farm animals are coming under this. It's not just domesticated animals, people mistreating horses or cattle or anything. And maybe that might be a reason for moving it.
Hmm.
They're going to build a new facility, they being the Anderson people. And they're going to have something where they can take care of horses and cows.
If they get that money.
You've got to get the money.
Now we have a really good question to ask the applicants for executive director. The real big issue is where does animal control go?
Well, the thing with that too is it's really not even, there's nothing as far as I'm aware of in the code that the executive director has over animal control. So it's just kind of.
Well, that's the
there's
thing
no
is that
financial
they're,
ties between the two anymore,
the county veterinarian, whatever they're officially called, is a direct appointment of the chairman.
Yeah.
And sort of different than the other executive directors in that sense.
Yeah.
Just because it's a particular statutory office that must be filled.
Yeah.
But that's getting not only down in the weeds, but down in the roots.
Another ad hoc committee that's formed to explore a different part.
I
of the
think
code.
that would be a great idea.
I think we should let Cliff Surges discuss it.
So yeah, send any recommendations you have. I'll be passing them along to Human Services probably next week. So, okay, let's move on. We have the executive director updates. Kathy Foster.
Okay, good morning. We have our usual COVID-19 updates, and Ms. Uche Anwuta, our Director of Health Protection, will be presenting that today.
Good morning.
Good morning.
Oh,
Is it not working? Taking an emergency call. All right, we'll pull the, Jay, is it the PowerPoint you sent last night? Okay, I can share it.
Yes, thank you.
All good.
I got it there.
I can start talking on the first slide. My name is Uche Omuta, Director of Health Protection for King County Health Department. The first slide I have, I shared the last time, but because we rushed through. Oh, thank you. Because we rushed through, I just want to explain. Oops.
And Uche, can you pull that mic a little closer? That's one of the ones that aren't very sensitive.
Oh, let me try this one. Okay.
Yeah,
Is
that's
it better now?
yeah.
Okay. All right.
It's weird having it right in front of your face. I know. Like, I don't want to be so close, but.
Okay, so this is the community levels that CDC put out last month. I talked about it in March, but just wanted to reiterate. These are the indicators we're tracking now. Admissions, hospital admissions for COVID, number of inpatient beds, and number of new cases. So for a county, a community to be low, they have to have less than 200 cases per 100,000. And also have less than 10 new cases per 100,000, less than 10% of staffed inpatient, less than new admissions per 100,000 and less than 10% of inpatient beds occupied by COVID-19 patients. If it's more than 200, it could be medium or low based on the admissions and inpatient beds, as I've indicated. Okay, so King County is in low community level, and that's because we have 81.52% cases per 100,000. We have 2 new admissions per 100,000 and 0.8% of inpatient beds. But I wanted to share the last presentation I had in March. The data is the next column. We were at 57.48, and you can see where we are today. Okay. So just the summary of this page is that, as you can see where we were in January, we've slowly come down. And if you can see a slight increase at the end, we're slowly ticking up. The number of cases the last 7 days increased by 30%. And the percent change in total deaths, 200%, even though it's less than 10. So that's not much significant. Now, as you know, we've distributed a lot of home kits. HHS distributed a lot of home kits. So this is just a fraction of the incidence of COVID-19, because when people are not reporting, we're not required to report home test kit positivity. So this is only those who went to do their PCR test. And same for tracking, sorry, for testing. So again, this is the SARS-CoV-2 variants in King County, looking at the specimen collection week. So these are week numbers. You can see that, is it the yellow one? Is that, okay. So this is Omicron. The B11529 I have here also includes the BA1. Okay, so the red is the BA2, which I pulled out just to show you that it's slowly going up. Interestingly, when CDC was sounding the alarm about BA2, we were just slowly coming up at the time. But now, as I can show you in the next slide, okay, so if you look at the last column, I pulled out the BA2, the percentage of BA2 of the total, and you can see that it wasn't, by March 5th, we're at 33%, and we slowly went up. It wasn't until the last couple of weeks, 72 and 77% of the total number of variants. That's, where we actually started going up. But nationally, they were already increasing by right about here. So, things happen differently locally than they do in other places. And again, I included information about BA2121. This is another variant that is coming up. I think it's about 20% nationally. We've only seen 2 cases here only in the last week that ended April 9th. Okay, looking at vaccination, not much difference from the last time I think 7 is a magic number. We seem to have gone up by 0.7% for each category. It's not even funny. Every single category went up by 0.7%, which is interesting. So that's our magic number. Not much has changed, but it's good to know that population 5+, we're about 71%, 72% vaccinated. So that's good to know. Again, I always have this on. There's no reason for anybody not to get vaccinated that is 5 years or older. There's a vaccine for everyone except the 4 and under. And that's it.
Any questions for Ms. Onwuta? Mr. Shepro?
Could we go back to the slide before the green graph chart?
This one?
But I think it was
Oh,
before
sorry.
this.
Before this one?
Right, yes.
Okay.
So if I read this correctly,
Mhm.
the number of cases, and these are reported cases, correct?
Right,
And
those who
right,
went to
it's-
get
I mean,
tested.
obviously, we
PCR.
don't know if they're unreported, but so that's up in a month by what, about 30-some%,
Mhm.
but the hospital admissions has dropped. By comparison, seems to have been dropped by more than half.
Right.
And this percentage of staffed inpatient beds seems to have dropped even more.
Mhm.
Does that reflect what I think I've been hearing and reading?
Right.
Is that the latest variant,
Mhm.
while highly contagious, doesn't appear to be nearly as serious as the previous strains?
So far, that's what we're seeing. You know, with COVID, one thing I don't do is say definitely this is what it is, because the following month I'll come back and eat my words. So so far it doesn't look like, but then, you know, we're not comparing apples and apples, because now more people are vaccinated. So what we're seeing is the effect of the vaccination, not necessarily the effect of
Within just the 30-day period?
Hmm?
I mean, you said we're seeing the effect of the vaccinations, but and we'll maybe go to that slide, but what I've been hearing from the talking heads on TV and in the newspaper, I guess, is that the needle has not moved very much. That even when the new booster became available,
Mhm.
apparently very few people have taken advantage of it. And one of the experts, I think, was from the National Department, was saying pretty much everybody who wants to be vaccinated has been vaccinated, and there just doesn't seem to be a lot more demand.
Right.
So I guess I'm really asking is, our takeaway from this could be that things are a lot better because hospital admissions and staffing have dropped dramatically,
Mhm.
even though people are getting, there seem to be more cases. And admittedly, I guess you don't know what will happen.
Right,
with
there's a
this.
lot that's playing in this drop, and it could be that maybe it's part of it, but the fact that we're seeing, you know, with the surge that we saw in January is coming down, and the new variant, the cases are going up, but this is at the early stage of the new variant. So people don't get sick on the first day. It takes some time before they go to the hospital. But if you're vaccinated, you don't go to the hospital. So it's not just like one thing is there's not one explanation. It's a combination of factors.
Then could we quick look at that The one that you stopped at, Jarrett, that had the four variants draft.
Uh-huh.
That was about. That's it. So is the original COVID, whatever it was, is that pretty much gone as far as
The alpha variant,
I guess it would, yeah, alpha, whatever we started with.
yeah, it looks like it's, it was taken over by Delta way early 2021. But it looks like now Delta, which is the blue one, is on the decrease, and then other variants are taking over. But I have to tell you that this is just a subset of the cases. So if alpha is maybe not as severe as it was at the beginning, and people are not getting to the hospital, they're probably not getting tested, because this is additional test in addition to the one you go to, the side IDPH lab to test. This is additional. So it's only a subset of all our cases.
My last question, thank you, Mr. Chairman. The stats on the vaccination rate, has that changed very much in the past 30 days or since the new booster became available? Or pretty
Not much.
Is it
no?
0.7? Is it-
0.7%.
Yeah.
Yeah.
Did you get yours?
Any other
Bates-
questions for
Bates,
Ms. Onwuda? Bates, go ahead.
Are we recommending the second booster now?
CDC recommends that anybody who's 50 and over should get vaccinated. We should get a second booster.
Do we need more of a community push on that? Or, because not very many people are doing that, right? Do we need more publicity or marketing on the second booster? More community education?
I would say there's always a need for additional marketing, but like Mr. Shepro said, people know where to go to get their vaccines. But I think we have the information on our website. We've sent out press releases for clinic days, and they're widely available at the pharmacies and many other places.
Even
Okay.
increased our dates. We added a couple Wednesdays for this
Right.
month, so, and we were back to just Saturdays, every other Saturday, so.
Mhm.
Okay, thanks.
Thank you.
Okay, any other questions? All right, thank you very much, Uche. So next up, we have some resolutions. Mr. Isaacson, are you presenting these?
Yes, so the first resolution, this is Michael Isaacson, Assistant Director of Community Health for the Health Department. We have a revision of personnel costs for our early childhood mental health consultation program. So this is where we have staff go into childcare centers and they provide training and support to the staff so that they can best deal with the needs that those families have. So frequently we'll be called in because they may identify a behavioral issue. So a center may say, hey, come help us with this kid. We're not actually there just to help with that child. We're there to help build up capacity for the staff. You may remember that in the fall, we received some increased funding for this grant that allowed us to create 1.5 additional positions. We have filled the full-time position, but we've had no applicants in the past 8 months for the part-time position. So what we're doing with this resolution is we're requesting to move the funding within the grant so that we can make that second position a full-time position, because we do have a fair number of applicants, which is good. And then subsequently, we've also secured additional funding for the next grant year so that this will be sustainable. So basically, we'll have 3 full-time people who are out providing this service. And then also as a reminder, this grant does cover Kane and DuPage counties.
Gonna get a motion in a second to discuss and potentially pass. Mr. Shepro moves.
Chappie seconds.
Mr. Chappie seconds.
Question.
Mr. Tepe.
Michael, can you give some examples of some of the organizations that you're working with?
Absolutely. So we work with home-based childcare centers or any childcare center. So there's 600 in Kane and DuPage County, perhaps. So there's a lot. Any childcare center that you drive past, we are reaching out to. And now if we increase our staffing by 300% from where we were a year ago, we'll be able to serve even more centers.
Do you have them on, I'm sure you've got a mailing list, but do you have them on email and things of that nature where you're able to?
We do. And this is actually a network where we work together with other organizations. So in our area, we work very closely with the YWCA of Metropolitan Chicago. They provide some additional services to childcare centers. There's a state system for training that we're a part of where you can get like an accredited training that we sign up and can offer. So our piece is one piece of supporting these centers.
Okay, and are you noticing any increase with, mental health issues in particular?
Absolutely. And unfortunately, this is something that's been going on over the past several years, even before the pandemic started, where we see more behavior with younger kids that's more acute. And one thing we want to avoid, and there's even been some legislation around this, is you see a 4-year-old who may get kicked out of a center. That may be fine for that center, but as a community, as a society, that child still needs to go somewhere. So rather than kicking kids out, which now they're not supposed to do, we're trying to provide them resources, and we're trying to get centers to understand, and most of them do, that a 4-year-old who's acting up, they may have experienced violence in their home. They may not have enough to eat. There's all kinds of, they may have untreated mental health issues of caregivers. So when they show up and they're angry, they're sad, they're whatever it is, they're not behaving the way we expect that a 4-year-old should. There's some things we can do to be a little more person-centered with them to provide supports. But definitely we've seen an increase.
Thank you.
I think we have somebody for this position already. Is that correct? Is that
We've
One of the
filled the
forms.
full-time position, and then with approval, we do have other candidates that we interviewed during the interview process for that full-time position that would be eligible for the part-time position once it becomes
yeah,
full-time.
so we should be able to fill the position pretty
Yes,
quickly.
hopefully within the month
Yeah.
or a month
Okay.
of getting approval.
Call the
at least.
question?
Any, Shepro?
Say, call
Oh,
the
call the
question.
question. I thought you said you had a question.
No, no.
Clerk, please call the roll.
Lewis,
Yes.
Shepro,
Yeah, aye.
Strathman,
Strathman, yes.
Tepe,
Epi, yes.
Wallace, Silva,
Silva, yes.
Sanchez.
Sanchez, yes. Okay, resolution passes. Can I get a motion in a second to discuss and potentially pass authorizing the purchase of naloxone nasal spray?
Strathman moves.
Strathman
seconds.
moves, Lewis seconds. This is pretty standard. Any questions on this? We do this every year. Okay, clerk, please call the roll.
Lewis,
Yes.
Shepro,
Yes.
Strathman,
Strathman, yes.
Tepe,
Epi, yes.
Silva,
Silva, yes.
Sanchez.
Sanchez, yes. Need a motion in a second to discuss and potentially pass authorizing the fiscal year 22 opioid overdose prevention grants.
Epi moves.
Tepe moves,
Strathman seconds.
Strathman seconds. Michael, do you have any comments on this one?
Yeah, this is a two-part resolution. So we have received some additional funding from the Illinois Department of Human Services. So the $69,993 is new one-time grant revenue that we're getting. We're adding that to existing plans that we had to provide support so that we could better treat substance use disorders in the community. We did put out a competitive request for applications, and we have selected 7 community organizations that we will fund. I noticed there's not a list in the packet. I do have a list that I can provide people, or I can read if you want me to put it in the record.
Sure.
Okay, so again, this was a competitive process. We have determined to give the VNA Healthcare $45,000, and this is to support them being able to provide medication-assisted treatment for people with substance use disorders. $6,200 to the state's attorney's office to help support their pre-arrest diversion program. We work very closely with them. $25,000 to an organization called Path to Recovery Foundation. And this is to put in some peer counselors that they would be able to work directly with people who are actively using drugs. $33,680 to AID, and this is to support their street outreach team, who does a lot of work specifically with the homeless population in our community. $23,500 to the Southern Fox Valley EMS system to do some additional education and to get more of our first responders on board. They're seeing this every day, so there's some additional training and education that we want to do with them. And then in turn, they're going to turn around and provide more community training. $45,000 to Lighthouse Recovery to hire an additional person, hopefully to knock back some of these waiting lists that we have for substance use treatment. And $33,500 to the Ecker Center for Mental Health to expand their hours for their peer prevention program. So again, this was a competitive grant. We weren't able to fund everyone who applied at the amounts that they requested, but we were able to at least provide something, assuming this is approved, to provide assistance to these great programs.
Excellent. Thank you very much. It's more money going out into the community for good use. Absolutely. Any questions or comments? Ms. Lewis?
I want to frame this the right way. The overdose prevention seems to me like it's always on the back end. You know, we do the Narcan and we deal with people once they've had the overdose or anything. What are we doing as far as on the front end with our efforts to not get to that? So more on the mental health side and more on the community awareness kind of stuff.
Yeah, great question. So part of this, especially with the EMS, we're going to be doing more prevention education. This grant really from the state, this funding comes from the Department of Human Services, is really focused on naloxone and harm reduction. So there's a bit of reactiveness in there where we're doing some things like leave behind programs where there is an overdose. We're making sure people have naloxone. We're looking at how we can make fentanyl test strips in partnership with the state's attorney and the sheriff's office so that people aren't being surprised and dying when they're not even knowing that there may be fentanyl in the drugs that they have. But separate from this grant funding, we also have other outreach going on. And actually, we just submitted a grant application 2 weeks ago to the Department of Human Services, where we are putting $75,000 in our budget specifically to do education and outreach. And if approved, which we anticipate it will be, that would begin on July 1st. That would be pushing out more prevention, I think, like you're asking about.
Okay, great. Thank you. Thank you.
And thank you for your comment, Anita. I mean, this is really, harm reduction is a better term than just dealing with addiction, and then all that we can do on the front end to make this more of a public health issue instead of a criminal issue, I think is extremely important and necessary for society, really. So,
And I think
this
if
is
I,
a good one.
one more comment, we just finished strategic planning with the courts. And I've mentioned before, I think that with Chief Judge Hull and with Sheriff Ron Hain and with State's Attorney Jamie Mosser, I think we have so many pieces in place at the county right now where there's tremendous opportunity to really move things forward. And I know in statewide groups that I work with, people are quite envious of a lot of the partners that we have in place. So even though we have a decentralized mental health system, which I don't think is good, we do have a lot of things that are helping us in terms of how we can best battle this.
Thank you.
Yeah, some key players. Absolutely. Okay, Mr. Tepe.
But before Michael leaves, or we get off his subject, and this is kind of an off the wall question, but what's going on with the IRIS system? Is that still continuing to be very effective?
It is. So Iris, and we had, I think was it 2 months ago, perhaps, we had a demonstration here. We're up over about 1,500 referrals. So again, this is our electronic 20 organizations who are signed up to participate, including mental health providers, including substance use, but also including a lot of other primary needs that people have. So whether they have needs for food, needs for help with housing or rent, we're continuing to see this every day just grow and grow. The team is going to be giving a presentation to the chambers of commerce up and down the Fox Valley. We have an event planned for next month with them, working with the township. So yes, it's continues to improve, and it's a wonderful system. And the beauty of it is that it's simple. That's why it works. So we can get a referral, and rather than handing somebody a piece of paper and saying, go here for help, and you don't know if the person ever follows up, this, we actually get a closed loop. So when the person is ready for a referral, you're actually contacting that organization that's contacting them, and we have documentation that it's been done.
Thank you.
Ms. Lewis.
So the Health Department did do a video of it, and I did send the link to everybody on this committee. So if you didn't see it or look at it, I can send it again to you. But it's very simple, like I could work it.
I've been
You
sitting
probably
in,
couldn't, but-
I've been sitting in on Michael's meetings now for a couple of years, so I just wanted to advertise it a little bit more.
Yeah, no, it's
Yeah,
good.
thank you.
It's excellent.
And thanks for bringing up the video. We're excited. We've been doing one-on-one sessions with
Mhm.
people. The team we have at the health department, Sophia and Kim and Anna, who work in our early childhood, our mental health and our substance use programs. But the video is going to be a much more efficient way to introduce people to it.
We gonna
Definitely.
put that on the website? Is that
It is,
something?
it's on our YouTube channel,
Oh, it's on the YouTube
channel,
channel.
yes.
So that's good.
and
Yeah.
there is a link on our website as well.
Okay, cool. So public can access it. It's not just the privileged information of the select few here anymore.
Hey,
All
we
right.
gotta have some up on somebody, don't we?
All right, clerk, please call the roll.
Lewis,
Yes.
Shepro,
Shepro, yes.
Strathman,
Strathman, yes.
Tepe,
Yes.
Silva,
Silva, yes.
Sanchez.
Sanchez, yes. It is approved. Okay, animal control. I know Brett is on vacation. Looks like we have Cameron from Animal Control. Are you there, Cameron?
Yes, can you hear me?
We can hear you. How you doing?
Awesome. Good. My name is Cameron DeBoer. I'm the shelter manager over here at Animal Control. On behalf of Brett, our revenue exceeded expenses this year, or this past month. And our vaccine clinic is coming this Saturday. It's the first of this year. We're very excited. It's from 10 to 1. It's low-cost rabies vaccine and microchipping. So we're super excited. It seems to really help the county, and also it, we love doing it for them. So we're excited to start off the year great. Hopefully it gets better every year. More people seem to come. So hopefully that continues to happen. So if you have any questions, feel free to reach out. Hopefully, we can keep getting better every year.
All right. Any questions for Cameron from Animal Control? All right. Thank you very much, Cameron. Appreciate you being here.
No problem. Thank you.
All right. We have nothing for old business. Someone please ask unanimous consent to
Unanimous.
place reports on file.
Unanimous consent to place
Mr.
reports
Shepro
on file.
asks, no objections. They are placed on file. No need for executive session. I have nothing for new business unless somebody in the committee has something under new business that I'm not aware of. Hearing none. Last-
In honor of Mr. Kenyon, I'd like to move for adjournment.
Mr. Tepe moves.
A second.
Shepro seconds. All those in favor say aye.